Hello everyone, welcome back to Medician, your trusted medical information channel. Today, we will discuss the details of the OUtMATCH trial, important considerations for using Xolair in food allergies, and how dosing works. I'm Dr. Lin, a board-certified allergist and immunologist, and most importantly, a proud YouTuber here to support you no matter where you are. If you missed our previous episodes on the introduction to Xolair for food allergy, including its mechanism and approval history, be sure to check that out, link above. Now, let's dive in. The pivotal study that led to Xolair's food allergy indication, the OUtMATCH trial, was published in the New England Journal of Medicine in February 2024. This study enrolled 177 children and adolescents from age 1 to 17 who are allergic to peanuts and other foods. To qualify, they had to react to 100 mg or less of peanut protein during an oral food challenge, and also react to 300 mg or less of at least 2 other foods from a list including cashew, egg, milk, walnut, wheat, or hazelnut. Then participants were randomly assigned in a 2-to-1 ratio to receive either Xolair or a placebo by injection every 2 to 4 weeks for a total of 16 to 20 weeks. After this treatment period, food challenges were repeated. The primary goal was to see how many could consume at least 600 milligrams of peanut protein without dose-limiting symptoms. And the results were striking. As shown here, 67% of participants in the Xolair group could tolerate 600 milligrams or more of peanut protein, compared to just 7% in the placebo group, a nearly tenfold difference. Secondary goals showed that the ability to tolerate 1,000 milligrams or more of cashew, egg, and milk protein was also significantly better in the Xolair group. In terms of safety, there were no surprises because the rate of side effects was similar between groups, consistent with Xolair's known safety profile. Because of this excellent result, Xolair is now approved for IgE-mediated food allergy in adults and children as young as 1 year old. The goal here is to reduce allergic reactions, including anaphylaxis, from accidental exposures to one or more food. However, it is more important to note that this approval does not mean you can freely eat foods that you're allergic to. The package insert clearly states that Xolair is to be used in conjunction with food allergen avoidance. Despite the promising data and broad implication, prescribing Xolair isn't always straightforward. Actually, choosing the right patient is a complex decision. And I think one major reason is that Xolair only works while you're taking it. So it requires a long-term commitment, meaning self-injections every 2 to 4 weeks. In addition, many other factors come into play. For example, considering a 40-year-old man with shrimp allergy who avoids shellfish and seafood restaurants. His risk of accidental exposure is pretty low that he may not want Xolair injections. Xolair may also not be ideal for a 20-year-old woman who has avoided peanuts for 10 years and is afraid of needles. On the other hand, an 8-year-old boy with a severe asthma and frequent accidental exposure to eggs and milk that he is allergic to might benefit from Xolair. As you can see, the risk of exposure and the need for Xolair vary widely. As an allergist and immunologist, here's how we evaluate. Does the patient truly have a food allergy, or is it food intolerance? Because Xolair won't help with food intolerance like lactose intolerance. How many food allergies do the patient have? Are there other conditions or diseases Xolair can treat, like asthma or chronic hives? What's the accidental exposure frequency and history of past reactions? Is the allergen easy or hard to avoid? What's the impact on their quality of life? And are they willing to commit to ongoing injections? If you decide to move forward with Xolair, the next step is dosing. Dosing is based on 2 things: total IgE levels, and the body weight. On the left of the dosing chart, you will see total IgE levels, and on the top, body weight in kilograms. Based on this chart, dosing is determined by matching these two factors, which will also guide whether the injection should be every 2 or 4 weeks. The gray area in the bottom right indicates combinations without enough data to recommend a dose. If you fall into that range, I would still recommend talking with an allergist and immunologist, as alternatives or clinical judgment may still offer a path forward. And with that wraps up today's discussion on the OUtMATCH trial, how to approach Xolair for food allergies, and how the dosing works. But we're not done yet. In our final video, we will answer the most common question patients often ask. Can I eat my allergic food once I start Xolair? We will also explore future possibilities in the world of food allergy. If you found this helpful, don't forget to like, subscribe, and leave a comment below. Let's keep the conversation going. See you next time.